What did I just learn? What was the name of that procedure called? What was that funky instrument that he showed me? Hey guys, welcome back to my channel. My name is Chrissy for those of you who don't know, or hashtag paging Dr. B for this dental series. So if you're new here, thank you for stopping by. If you're old, I appreciate you for coming back. So today we're going to talk about how to shadow a dentist. Now I've seen you guys ask me questions like this before and I was just like, I almost forgot about it. And I'm like, you know what? This is actually pretty easy. I'm going to try to make this video very short. So just keep on watching. Oh, if you haven't done so already, please do check out my last video because I am hosting a giveaway. Yes, you heard correctly, another giveaway. I will link the video above and down below. Pretty much it's some goodies for some people who are studying for the DATs. I believe the giveaway closed April 24th, so I allowed it to be open for 3 weeks. So if you haven't, please do check it out. The giveaway instructions are very easy. All you have to do is like, comment, and subscribe to my channel and tell me why you deserve that item. And while you're at it, just go ahead and subscribe. Like, I'm fun. For those of you who are not familiar with dentistry, please keep in mind that according to the ADA, there are now 9 specialties of dentistry. So before you shadow a dentist, I would highly recommend you guys look and see what type of dentist you would like to shadow. So to get into those, number 1, we have dental public health, which pretty much focuses on statistics, epidemiology, how to prevent and control diseases, as like they more so look at the broad spectrum of like, okay, how does this state compare to this state compared to this country when it comes to this particular dental disease, say for example. That's 1. Number 2, we have endodontics, which is a fancy term for people who do root canals. So number 3 is oral and maxillofacial pathology. Pretty much, say for example, if you have something growing out of the side of your face and or in your mouth, what they do is they'll go in, they'll biopsy that area to see what exactly it is, and they focus on identifying what that is and how to prevent it and or how to treat it. Number 4, you have oral and maxillofacial radiology, which are the people who interpret radiographic imaging. Number 5, which is the most common, I think most people know what an oral surgeon is. So say for example, if you have an impacted tooth, they will be the ones who go in there to try and get that out. Number 6, you have pediatric dentistry, which is just another term for people who mainly practice on children. Number 7, you have orthodontics and are the people who put on braces. Number 8, you have the periodontists, which are the people who mainly focus on gum disease, which pretty much is like, say for example, your bone level, if you have bone loss in your mouth or any kind of bone related diseases. And number 9, you have your prosthodontics, which are the people who do dentures, in layman terms of course. I explain everything in lay terms just in case if you guys aren't familiar with what these terms are. For more information on these specialties, I would highly recommend you guys to go to the ADA website and look over them. Now keep in mind, these are specialties. So in order for you to become a specialist, you must be a general dentist first. A general dentist encompasses all of those specialties. Say for example, general dentists, they can see children, they can extract a tooth if it's not impacted, they can do root canals if it's not too complicated. So just to get like a general idea, your general dentist can do all of those things so long as it's not complicated. And because of that, I would highly recommend you guys to shadow a general dentist first, so that way you see all of the specialties in one. Okay guys, so I know most of you are probably here because you're traumatized by this whole experience, but I can assure you there really isn't a need to be. You can do what I did. Simply go into Google and type in dentist near me. Now because I live in New York City, it is saturated with dentists, so for me it was not hard at all. What I would highly recommend you guys do is first start off with this. Now because I live in New York City where the insurance, dental insurance is very high, you know, some dental offices are actually a bit more stringent than others. For example, some dental offices require that I do the HIPAA training. HIPAA stands for the Health Insurance Portability and Accountability Act, which is just a fancy term for you cannot violate patients' rights, you cannot invade their privacy, you cannot share their private information with anyone outside of the dental office or dental facility. If you're fresh out of undergrad and you're just like, well, where do I do this? Some places they may offer the training for free, while I don't think I've ever heard of any other places where you have to pay for it. You shouldn't have to pay for the HIPAA training, but I would double check that. Some dental offices in the city can be a bit exclusive meaning that they're not as receptive to people, even if you are just trying to assist or i.e. work for free, mainly because it's not always the dentist, but I think dentists worry a lot about what their patients might think if they see someone else in the room while they're working on them. I do recall there was like a number of dentists that I called and they just shut the door in my face. They were just like, oh no, we don't do that here, and that was that. And then after the fact I come to realize that, you know, it's not that they didn't want me to be there, but it's just they worry a lot lot about what their patients think. Now, another option for you guys is to go to a dental facility. Usually these are hospitals, and within the hospitals there's a dental clinic inside. What I would just do is find the nearest hospital that you know has a dental facility inside, go to the hospital and go to their HR department. Usually HR is very helpful for those who want to volunteer. If you just go to HR and say, hey, I'm interested in being a doctor, a dentist, an ophthalmologist, and there's a clinic within their facility, they would actually give you the application to fill out to become a volunteer. That's the easiest way, in my opinion, to go about shadowing a dentist. Another advantage about volunteering in a dental clinic within a hospital is that when you fill out your application, they actually have a section on there that says you must do your HIPAA training, and usually the hospital will set that up for you for free. I think all you have to do is just pick a date and time. So that's definitely killing two birds with one stone. Also, they actually keep a timesheet for you. So when it comes time for you to fill out the application online with AdSAS and it asks you, how many volunteer hours you did, you can just go over to the hospital and ask them, hey, can I get that timesheet? And since it'll have it by your name, date, time, and how long you were there for, you can just easily just transfer that information onto your application so you don't have to worry about it. Now, if you choose to not go to a hospital, that's also fine. Just keep in mind that if you are in a dental office or wherever you might be, even in a dental school, I would highly recommend you guys to just keep track of how many hours you're there for. I can provide an easy, quick table somewhere on the screen for you guys if you haven't done so already. What I did with mine, I believe mine, it was my name, date, time, and there was a person within the volunteer office who signed off on it to make sure that I was there. And also it gave me food vouchers. Food for thought. Now, if you guys choose to shadow at a dental school, it might be a little bit tricky because I do believe you have to go through the same HIPAA training. Each dental school is very different. What I would highly recommend you to do is to go to that dental school and ask them what their protocol is and follow through with it. Now that you've gotten all of that out of the way and now you're ready to shadow, you're going to need scrubs because you don't want to get your good clothes messed up. And of course, you're in a dental facility, so you want to present yourself as professional as you can. Most places, they allow you to wear scrubs. Some might say business casual. If you're anything like me and you're super duper clumsy and you're wearing these simple flats, I can easily trip on anything because that's just how I am. So I prefer to wear scrubs with sneakers, comfortable sneakers with nice grips and soles. Another major factor that I must touch on is your safety. Say for example, if you're a dental volunteer, one thing I would say to just be very mindful of is sharp instruments. Sharp instruments is any dentist's worst nightmare because if they puncture your skin, you pretty much have to stop the procedure, run over to the hospital where they give you all of these cocktail shots just in case if the patient might have had something. And it's kind of scary. It's a bit traumatizing. It never happened to me personally, but I do know people who it did happen to, and it just created a mess because those cocktail shots, from what most of them say, do make you sick. So please do be mindful of your surgical gown because sometimes as you're reaching for certain instruments, it can get caught in the handpiece and or burr. Or say for example with the syringe, if the needle is still attached, they highly recommend you use the scoop method to put the needle back into the cap instead of physically picking up the cap and putting it on. You don't want to do that because they say that's a very good chance of it puncturing your skin, and you don't want that to happen. Guys, one thing I would highly recommend that you do, especially if this is your first time shadowing a dentist, is to write things down, mainly because you're seeing so many different things, you're witnessing so many different procedures, you're seeing how the dentists interact with the patients, and the worst thing that can happen to you is that after you've witnessed all of these awesome things and you felt like you learned everything, and then you go home and then you go, wait, what did I just learn? What was the name of that procedure called? What was that funky instrument that he showed me? That is the worst thing that could ever happen. I had a small notebook, no bigger than the size of my hand, and in between patients, I would write things down. Okay guys, so I think I touched all the main factors of shadowing a dentist. I get this question so many times as to how do I go about shadowing a dentist. I'm hoping that this video was helpful for you. If you can, just please do like, comment, and subscribe down below if these tips were helpful. Again, my name is Chrissy and thank you for watching. Bye. And of course guys, I didn't forget, make sure you brush your teeth.